there we have it. Well, good afternoon, everybody, and thank you for joining me today for our Facebook Live about contour TRL, deep laser resurfacing, and micro laser peel. And this is something that we do quite a lot of in our office. So I'm going to explain to you what it is, what it's for, what results you can expect, and recovery. And any questions we have along the way, please just put them in the comment section and I will respond to them. But hello, Alexis, Debbie, and Ellen. Thank you so much for joining me. As always, I like to begin with a little bit of background science because I just love understanding the technology. I won't bore you too much. But in the picture here, you see this is the laser module, and it's actually a combination of two different lasers, one ablative and one non-ablative. So if we look at this chart right here on the lower right-hand corner, so this dotted, dashed red line shows the threshold for ablation. So ablation is when tissue is completely vaporized, completely destroyed, which is what we want sometimes when we want to get rid of dead tissue on the outside layers of skin. And that's what this blue band up here is showing. That's one of the frequencies. It can give you a short pulse, very, very high intense heat. And this is important that it's short burst and it's high intensity, and it's an erbium laser in case anybody wants to know, because it has very little collateral damage. So it shoots in one area and the heat does not really transmit to collateral areas. There's a second laser that works just almost identical to the first laser, except it has an ablation threshold, it's below the ablation threshold, so it does not destroy the skin, but rather just heats it. And the difference is that when our skin is heated to a certain temperature, it induces collagen growth. So the skin will actually get firmer, tighter, and healthier, because it has essentially a micro trauma. It's not enough to kill the skin, but enough to stimulate our body's own healing mechanisms. So we use these two different lasers together with both the contour TRL and the micro laser peel to achieve the results we want. So that's sort of the science behind it. Now, this slide it's really one of my favorites, and I use this all the time when I'm explaining contour to patients in the office. So I'm going to use it here as well. What we are looking at in this picture is a cross-section microscope view of our skin. And so let me kind of walk you through what you're looking at here. The outer layer, this is the top of the skin, right? And this is the outer layer. Now, if you think about the skin as having two layers, your epidermis is the outer layer and your dermis is the deep layer of the skin. We're actually going to break it into three. We're going to break it into the epidermis and then the superficial and the deep dermis. But out here, we see a sort of roughened, sort of irregular border. Well, I mean, the deeper these lines are, the deeper these little ridges and troughs are, the deeper the wrinkle is. You're looking at a cross-section of a wrinkle here. And this could be a really fine line here, and this is going to be a deeper line. But we can see that the skin has a very irregular texture to it. The top part here, that's the deep, deep purple, that is the epidermis. And we need to talk about the thicknesses of these different levels because it's going to matter how we treat the skin. So it's, just so you know, it's roughly about 100 microns deep here. And in different parts of the body that is less or more deep, as we have thicker or less thick skin. But in this slide, it's about 100 deep. Then you get into this sort of brighter pink peach color area. That's our superficial dermis, the papillary dermis, and then below that is the big, thick bulk of it is the deep dermis or reticular dermis. Now, why does this make a difference? Well, the epidermis provides the barrier function of our skin, right? So when we completely obliterate that, which we do in a deep laser peel, there's going to be a little bit more healing as the body allows it to resurface itself and prevent water loss and vapor loss, and that's why we have to protect our skin in that immediate healing phase. But imagine if we got rid of that entire outer layer and we started with a smooth, flush surface. When that skin heals back, it's not going to have all those fine lines and wrinkles and irregularities. So that's one of the reasons that deeper resurfacing works. And the only way to do that is to truly ablate or vaporize or get rid of that tissue. Think of it like sanding. We're just smoothing out that outer layer by removing parts we don't want. But unlike sanding, our body can heal, which is great. We're not a block of wood. And the other thing you'll notice in that outer layer of epidermis is it's dark. And that darkness is the melanin. That's what gives our skin color. So if we have light and dark spots, dyschromia, irregularities in the pigment of our skin, getting rid of that entire layer will help us to kind of reset the pigment in terms of more uniformity. So I really like showing this graph. And then now to give you an idea of how deep these different peels go. So if we were doing a micro laser peel, which you see here, we're only going about 50 micrometers deep. And that will get us into the epidermis and just touching into the dermis. So in general, I usually tell people that for every 10 microns, we have about 1 day of healing. It's a good rule of thumb. It doesn't hold true when we get to the deeper layers exactly. But if we did a micro laser peel, I would tell somebody by about day 4 or 5, they would look pretty much normal with no makeup. And then as we go deeper than that, our healing time, of course, is going to increase, but so will our results. And then you can see on the right side here, a deep resurfacing. It says up to 330 micrometers ablation and coagulation. Well, that's not entirely true. In some parts, which we'll talk about later, I'll go down as far as 7 or even 800 microns deep. So we can really affect some significant changes here. That's kind of it for the sciencey part. Now we're going to move on to what it does, right? So let me show you some examples. I think the biggest area that we see a need for correction is around the mouth. And I've had a lot of patients for this, but one of my favorite patients, one of my first patients actually, to have this done. And let me see. I want to show you. That's not her. Let's find her face. Is this it here? Okay, yeah. This was her after her first treatment, and I think she came back later for some more. Well, anyway, we can just take a look. You'll get an idea here. So this was her after her first treatment, and her major concern were these fine lines around her mouth. And we're going to take a step back here, because when you look at the face as a whole, and of course we treated the entire face with laser and then we treated around the mouth. But when you look at the face as a whole, what kind of jumps out at you is around the mouth. And the thing about the mouth being special is that it doesn't respond well to a lot of surgical treatments. In fact, it doesn't respond to surgical treatment very well at all. If you think about our face, if we pull hard on the sides of our face, it will tighten out our cheeks and our jawline and jowls and neck, but it really doesn't affect around the mouth. And there's just so much motion. People say all the time when they ask about their smoker's lines, they say, oh, I never smoked. How come I have smoker's lines? Well, the reality is we're always moving our mouth, just like I'm doing right now. And that motion, that animation, whether it's talking or drinking or speaking, pulling from a straw, all those things activate the muscles around our mouth, and it can cause lines and wrinkles. And genetics play a role, and sun damage plays a role, and of course age plays a role, but it's not always because of smoking, although absolutely smoking makes it worse for a number of reasons, as we kind of know. So at any rate, that's a good example of the up close of how those lines work. And then we came back and did a little touch-up. I got to find her touch-up photo for you because it really looks pretty fantastic. Let's see, where is it? To the top. Here it is. There, okay. So we went back and did a touch-up. And what you'll notice is that after a second treatment, it's even smoother. The little fine lines of the chin are now gone. All the lines of the upper lip are gone. One of the things to note is that there's a finite depth that you can do with one treatment. And while most people see their maximal benefit that they are looking for in one treatment, some people need a touch-up, and it's usually in the areas that have the deepest lines. So when it comes to fine lines around the lips, there are several options, including filler, and Botox has a role as well. And filler can do an excellent job, and it's quick, but it will never be quite as thorough as a deep laser. So this is my go-to favorite tool for quote-unquote smoker's lines. And so you can see that. And I'm going to talk about the results first, then I'm going to tell you more about how the procedure is done and then recovery, just so you understand what we're talking about. Let's look at some other faces here to give you different examples. Here's a patient who has a lot of sun exposure, obviously solar damage, and when we do a full face deep laser, we're going as deep as practical and safe across the entirety of the face. And you will notice that right from the very hairline down, we're going to have diminished lines, better skin complexion, or evenness of the tonality. Those brown spots, the dyschromias are going to be better. The eyelids as well, upper and lower. In this case, we just did the sides and the lower eyelids. And you'll see that that's going to be smoother and tighter and brighter, and then across the entire face. And people, when they look at some of these photos, they correctly guess that something is really been altered, but they can't put a finger on it. A lot of people think it's a facelift. It's not a facelift. Actually, there's completely nothing surgically done for this patient. All we did was repair her skin. We got rid of the lights and the darks. We got rid of a lot of the fine lines, and we deepened, or rather we tightened the deeper layers of skin. And that's what you're seeing there. That's why the jawline looks so smooth and so tight. And it just looks like a much more youthful, rested version of that person. And I welcome anybody who's just joining us, and if you have any questions about deep laser resurfacing, please let me know. I am happy to answer it. Now, let me show you somebody who was nice enough to take some pictures shortly after the procedure. So this is another full face deep resurfacing at 10 days after. And so at 10 days after, the areas that are still pink are going to be the really deep areas. So around the mouth and a little bit under the eyes and between the eyes, the glabella. But the remainder of the face is going to look pretty normal at 10 days. Now, she could wear makeup at 10 days and look pretty normal. But I just kind of want to show you what it looks like after about 7 to 10 days. So people know that you're going to look a little bit pink, but you're going to look normal with some makeup. And so that's a good idea with this patient. And then we can see her results at a few months where things have sort of smoothed out, and especially the skin under her eyes and around her mouth just looks a lot more refreshed and youthful. We don't only use it for the face, we'll also use it for the chest or the décolleté. And in this patient, we were just doing a lighter peel, and we don't go very deep with the peel. This is a micro laser peel, meaning she would be pretty much normal in about 5 days. And we just covered the entire chest to try to get rid of some of those light and dark spots and fine lines and wrinkles, just to sort of smooth out the complexion of the chest. And I believe we also did same thing for the face. We did a micro laser peel for the face. So sort of went from the hairline all the way down to the sternum. And that way there's a more uniformity to that. Now, let's look at some eyes, lower eyelids. We do a lot of lower eyelids. This is an example of somebody who we just wanted to get some of these fine lines out. And we did a deeper peel. TRL stands for tunable resurfacing laser, in case you were wondering. That's another synonym for the deep laser peel. And at day 6, it's a little puffy, which is actually kind of a good thing. We all know that some filler under our eyes looks good. But the point is that even 6 days later, her face looks very presentable. And that's one thing I try to encourage people to know, that they're going to look fine after a week or so. Maybe not perfect, but enough that makeup will cover it. With rare exceptions, there are some patients for whom we go pretty deep, and we'll, of course, advise if that's going to be you. Let's look at a couple more photos here. Another, beautiful lady, great bone structure, just enjoys the outdoors. And some of these finer lines around the corners of the mouth and the cheek, expression lines, it's good. You're happy, you're smiling, that's wonderful. But this is the perfect procedure to both smooth out those fine lines and also address some of the skin tonality. And again, it's a very natural look. It just looks refreshed and wonderful. And we could go on and on and on. I don't want to bore people. I'll just show you maybe one more, because I love this result. This is a friend's mom who I was honored to take care of. And same thing, just a lot of sun damage. And what a beautiful result. Her skin just looks so much healthier. She just looks so much more youthful. And you can see how we really addressed those dyschromias. And some of these brown spots are actually raised. They're almost like moles, and we were able to plane those down as well. And then with this young lady, we went on and we did her upper eyelids surgically so that we kind of completed the package and really both addressed some of the aging processes that can't be addressed with a laser surgically. Really, they're very complementary. Surgery and skin care with laser are just so complementary. So now let's just shift over and talk about how we actually do the procedure. You know, what happens during the procedure. So we can certainly use this lady for an example. What we would do is we would cover the entire face with a numbing cream for about an hour, and then for most patients we would offer a sedative. It's an oral sedative that works almost instantly and is very safe. It doesn't require anything more than just basic monitoring. We don't need any IVs or lines or anything like that. Just sort of takes the edge off, so to speak. And then beyond that, I will do some local anesthetic nerve blocks. So I'll do nerve blocks that block the forehead, around the eyes, the mid-face, the jawline, and especially around the mouth. So you're going to feel like you're at the dentist, and it will be really, really numb. So the combination of the topical, the oral sedative, which isn't mandatory but helpful, and then those nerve blocks have made this a very well tolerated procedure. Nobody really complains about the procedure being painful. We get through it just fine every time. Now, after the procedure, we put a red light. As you guys know, I'm a big believer in red light therapy to promote healing, decrease inflammation, decrease discomfort. We'll put that red light on for about 20 minutes, and then after that, we're almost ready to go home. We're going to cover all of the superficial layers of lasering with a topical moisturizer. The deep layers, which typically are around the mouth and under the eyes, but for some people could be the whole face. Those areas we're going to cover with a non-stick gauze just for the first overnight. So I'm going to apply it, I'll give you supplies to go home, and you'll reapply it that first evening. And the reason we do that, as we talked about way in the beginning, if we're taking out that whole epidermis, that barrier function, there will be some oozing and some weeping. That's just inevitable with this procedure. But it's not remarkably uncomfortable, and especially if we keep it covered, we allow that little bit of seepage or oozing to get into that gauze, wick away from the skin, and not crust or scab. So it won't look horrible and it will be difficult to clean. The next morning, we'll come back to the office and one of the nurses will take all that gauze off, gently wash the face, and then teach you the post-procedure care routine. People kind of get upset about this because they think, they see vinegar soaks. Vinegar soaks? We're not pouring vinegar on your face. It's mostly sterile water, or saline in this case, and a little bit of vinegar. And the vinegar is both antiseptic, antibacterial, but also has a healing, cooling property. People say it's actually very soothing, especially when it's very cold. And so we're going to do that for the first few days after to just keep the face clean and moisturized and healing. And then when we get out to day 4 and 5 and 6, I showed you some of those photographs, you're going to look less red each day. The first few days are very, very red. It's not remarkably painful. It's not difficult to take care of, but you're going to scare people the first few days. When you get out to that day 5 and 6 and 7, remarkable transformation. By then, the skin is well healed. It just looks like a bad sunburn. You can cover it with makeup. And then when you get out to 10 and 14 days, at the worst, it would be a pinkish hue. And then 3 to 4 weeks, even the deepest of peels will maybe just have the slightest pink hue, although all this gets covered with makeup from an early spot in the procedure. Let me give you an idea of what I mean by that oozing. People ask me often what it looks like, and I have a patient who was nice enough to show what she looks like. So we were working on some scarring around her mouth, and the picture on the left is that first morning after treatment. So we really just worked around her mouth. The rest of her face wasn't treated. And you can see after we take off that bandage, the non-stick bandage, there are focal, pinpoint, punctate areas of bleeding, for lack of a better word. There's just drops of little blood in there. And that will stop within a number of hours. And it looks really raw, but it's not horrific looking. And I think when people see this, they realize it's not that scary. And then day 4, you can see on the right, she's still very pink, but the skin is now dry, the barrier function has been restored, and we're just moisturizing. We no longer need to clean and soak. And then when we move out to a week, we can see that there's a little bit of a pink. There's a pinkish hue when compared with the surrounding untreated skin, which I rarely do. It's one of the reasons that I always like to treat the entire face. This was an exception. We were really just treating these focal scars. So when we get out to a week, you can see that you could easily cover that with a little bit of makeup, and you know, a few days from after that, she'll look pretty good, pretty normal. All right. Other things we can do. It really works well for eyelids. Let me see if I have that's just that's another doctor's photo, but showing how profound you can tighten the crow's feet. Let's talk more about healing. These are examples of patients who had various levels of peel, so you can see what their recovery process looked like. Now, this is a 20 micron peel. This is a really, really light peel. This is sometimes termed a nano peel or a lunchtime peel. There's certainly merit to it. You're basically just taking the outer layers of the epidermis off, and you'll smooth out your face. You'll have a little bit more of a glow, and there's very little downtime. When you get into the deeper micro laser peels, you know, it's going to take a few days. Remember I said 10 microns per day for healing, so about 3 days. You can see in this intervening frame between 2 and 4 is when it sort of turns normal. And then you go to a deeper peel. So this is a 60 micron peel. This is going to be more than a light peel. This is considered a deep peel at this point. And she's had some acne scarring that was being worked on. And so 2 days later, she's very, very red, but dry. You know, we're just moisturizing this. We're not absorbing any oozing. And then on day 4, she looked pretty normal. And then up to 3 months, you'll see the skin continues to improve. So you might be wondering, well, if it's all healed at day 4, why does she look better at 6 months? And the reason is because we talked about how that subdermal heating of the tissue, it's not ablative, but it's heating. And that subdermal, subablative injury really stimulates collagen, and peak collagen production is weeks later. You know, it can even be 2 to 4 to 6 weeks later, and that's why we see a final result really out by about 3 months when the collagen deposition is finished. However, in my experience, I see people improve out to a year. You know, I'll have seen them at 3 months and then see them again at a year, and we're all very impressed at that difference. So I believe that collagen deposition continues out to a year. Under eyes, so I'll show you what a deep peel under eye looks like. This is my deep under eye peel that I would do for somebody who has really bad dark circles or wrinkles or whatever it is. This is not my patient. This is another physician's patient. However, I'm using it as a good example because I do think it is somewhat representative of what the results look like. So day 2, you know, she's red, and day 3 she's starting to get a little bit of sloughing. Now I have to say, in my experience, I don't see a lot of skin sloughing. I'm not sure what this physician did a little differently than I do, but typically I don't have skin like flake off or you know, peel off. But it looks like that's what's going on here day 3. By day 4 she's really red. By day 8 there's a little bit of pinkness, and I'd imagine by about 14 days she would look normal. Of course she could put makeup on to cover it, but her eyes just are going to look so much brighter. That skin underneath, you can see from the pre-treatment photo to the post-treatment photo, you remove that darkness. Now, why do we have dark circles under the eyes? Well, it's a longer conversation for another day, but part of the reason is that skin is very thin, and as the capillaries leak, the red blood cells break down in the skin, and they essentially stain the skin. And once it's stained, it's very difficult to get that out without ablating it, vaporizing the stained skin, and allowing new skin to grow in. So it's not really magic, but it really works like magic. Also, we use it for skin contour, like acne scarring. So, you know, use an area, again, not my patient, but I do use this for acne scarring in combination with other treatments. And we have these deep atrophic scars. We have a combination of ice pick and box scar type scars. You know, and here's this patient after 1 treatment. So you can see how we've both smoothed out that contour of the scarring and also filled in. And of course, it's a little bit red still in certain spots, but it's a very, very versatile tool. So let's see, what else can I talk to you about? Oh, this is kind of a cool slide. Again, this isn't mine either. I do most of these in the office. You can see this patient is intubated. This was done in the OR, but it's really done just as a demonstration type purpose. If we look at her upper lip, look at the right side. Before you treated, you see these fine lines in there, smoker's lines. After 200 micrometers of ablation, they're starting to fade, and at 400 they're fading even more, and then 600, and then finally 800, and you can see it's smooth. It's really very gratifying as a surgeon to do these procedures because you can see it before your eyes. You can see the healing occur before your eyes. So that concludes the talk about the contour TRL, deep resurfacing and micro laser peel. I think one question that people will ask me often is how long do the results last? And the answer is years and years. This isn't like a injectable that will wear out or fade away. We are resurfacing the skin, and it takes years and years to develop light and dark spots and wrinkles. The aging process takes years. So we're undoing decades with one bound. It is almost always one treatment, except for some touch-ups, as I said before. And as long as you can give yourself the time, the social downtime, it's very well tolerated. Nobody has said, "Oh, that was awful. It was a really painful experience." We've gotten very adept at making people comfortable during the procedure. But yeah, it's a solid week where you're going to want to not see people. However, 1 week for these kind of results, I mean, there really isn't another tool that I know of, especially for around the mouth, that can get such consistently good results. And so that concludes my talk about the Contour TRL laser resurfacing system. I thank everybody for watching. I hope you learned something. I didn't get any questions, but maybe I just had all the answers. So, thank everybody for joining. Have a wonderful day, and we'll see you next time.